Hi, I'm Dr. Richard Brownlee, and I'm a neurosurgeon. I work at the Welcome Back MRI and Pain Management Center in Kamloops, and I'm here today to talk about your spine. So this is a model of a spine, and this shows all of the vertebrae in the spine from the skull all the way down to the pelvis. So there's certain structures in your spine that are the common sources of pain. If you have chronic pain in your neck or back, it's likely that that pain is either arising from one of these little joints in your neck or back called facet joints. In your lower back, the pain could be arising from what's called your sacroiliac joint, which is part of your pelvis. If you have arm pain, then it often is related to a pinched nerve in your neck, and the most common cause of that is what's called a disc herniation. So the discs are these little spacers in the front of your spine, and there's a disc in between each of the vertebrae in your neck and in your lower back and throughout your spine. And if you have sciatica, which is pain in your leg, same thing. That's usually due to a disc herniation in your lower back. So one of these discs have herniated and are putting pressure on one of the little nerves in your lower back. And the distribution of your pain depends on which nerve is being pinched. So the best way to investigate spine-related problems is by doing an MRI scan, because an MRI scan clearly shows the nerves, the spinal cord, the discs, the facet joints, all the anatomic structures in your spine. So it would show if there is something pinching your spinal cord or any of the nerves. The advantage to doing an MRI scan at the Welcome Back Center is that we have the only upright positional MRI scan in Canada. So when we do MRIs on people, we do all the spine MRIs with people lying down, sitting up, bending forward, and bending backwards. So that gives us information on what happens to your spine in different positions. Most people find that their pain changes depending on what position they're in. A lot of people, their pain goes away when they lie down, and every other MRI clinic in Canada images people just lying down on a table that takes them into a small claustrophobic tube. At the Welcome Back Center, we do people lying down, but we also do people sitting up and bending forward and bending backwards. And the MRI machine is open and comfortable, so if you're claustrophobic, people typically don't have a problem with our MRI machine. You can sit and watch television while you have the MRI of your spine done. And doing 4 different positions is like getting 4 MRIs for the price of one. It gives your treating physician more information on where your pain's coming from, which gives options on how to treat your pain, whether it be neck pain, arm pain, or leg pain. It all depends on what's causing it when it comes to treating it. So if you're having problems with your spine or with your pain in your arms or legs, give us a call. We can arrange for you to have an MRI scan and potentially figure out where your pain's coming from. And if it is facet joint pain, we also do diagnostic injections of local anesthetic. Each of these little joints in your spine have 2 nerves that go to them, and if you freeze those nerves, it will eliminate the pain from that particular joint. So you can freeze a number of different joints at one visit. We typically do it one at a time, where you freeze one joint, let the person get up, do some bending, twisting, see if it's eliminated their pain. If it hasn't, then we put them back on the table, freeze the next joint, let them get up again and test it again. And if you do that, you can often identify where the pain's coming from. If it is a facet joint problem, cortisone shots sometimes can be helpful, but there's another procedure called facet joint rhizotomies, which is much more beneficial for eliminating back or neck pain, and that involves putting a needle into the back and putting an electrode down that needle. It passes an electric current which cauterizes the nerves to those joints. So if you do that, it will get rid of the pain from the joints, often for a year or more, and then if the pain recurs, you can repeat the procedure. So it's a very common source of back pain and neck pain, and being able to identify where your pain's coming from and eliminating it can improve your quality of life and let you get back to doing normal activity. So if you're suffering in chronic pain, give us a call and we can probably figure out where your pain's coming from and help you get some relief.